Okay,
अच्छा
live.
अब आ गया.
So guys, we are back after a break. So let's continue with the questions. So this one is from Ikra Iqbal. She asked, and let me quote it for her. And it says, when I should apply for CSA, if I'm doing CPA right now, and I want to give CS in February, and I have to apply for visa on the basis of CSA. How should I choose date and apply for the visa? Secondly, should I start applying for observership only after visa? As the required documents include visa, which should I apply for? So you get the like question. Assalam, right?
Okay, Hassan.
जी. Uh, so the question was from Ikra. Uh, I think the most important part is that, as I would give my own example, that when I was basically taking the date for my CK exam, I also paid for the CS exam right there and then. The benefit is basically most of the candidates have very less time after the CK exam to take the CS, mostly like 1 month, 25 days or 30 days. So it's practically impossible to apply for CS exam after taking the CK and then secure a good date in Chicago or wherever you want to take that. So I would highly recommend that if somebody has less time for CS exam after the CK, then pay for the CS date along with the CK exam or as soon as you can do that. It would never hurt you to book the date, before the CK exam of your CS. Second thing is you can apply for your visa on the basis of the CS before the CK exam as well. Some people have an issue that when they apply for the visa people say that you have not taken your CK exam yet, and then why are you applying for the CS? I think that happens only for like 5 to 10% of the people, and it's not a big deal. If you explain to them in a nice way that I've already taken my step one exam, I'm gonna take my CK on this and that date, and then I would have like 20-25 days to prepare the exam, and the preparation is mostly in US, so I think they would understand the thing. So the baseline is pay for the CS exam as soon as possible along with your CK, secure the date in Chicago or wherever you want to take the exam as soon as possible, apply for the visa as soon as possible during the CK exam, and try to grab the visa. uh, Most of the people, like 80 to 90% of the people, get 5 years multiple visa. The rest of the people, 20 to 10%, they also get visa of at least 6 months. So in any case, you would be able to do observerships, externships in that trip of the CSXL. The other thing is, she said that when should we contact the programs about the observerships? I would say as soon as possible. Everything is USMLE should be done as soon as possible. मेरे बहुत सारे जो दोस्त हैं जो कि जिन्होंने इस साल का मैच अप्लाई करना है इस सितंबर में, दे आर कॉन्टेक्ट द प्रोग्राम्स विद ऑब्जर्वरशिप राइट नाउ. और जब वो अब अप्लाई करें तो ज़्यादातर प्रोग्राम जो ये कह रहे हैं कि हमारे पास दिसंबर की डेट है, हमारे पास जनवरी की डेट है. बहुत अच्छे अच्छे प्रोग्राम्स माउंट सना है एंड यूनिवर्सिटी ऑफ फ्लोरिडा और इस तरह के प्रोग्राम्स, वो कह रहे हैं हमारे पास जनवरी की और फरवरी की डेट्स हैं. करंटली डेट्स नहीं, क्योंकि इस वक्त सारा प्रेशर प्रोग्राम्स के ऊपर होता है ऑब्जर्वरशिप का तलाश करने के लिए जिन लोगों ने इस साल का मैच अप्लाई करना है. सो आई वुड से कि अगर मिसाल के तौर पे आप नेक्स्ट सितंबर का मैच अप्लाई करना चाह रहे हैं, नेक्स्ट सितंबर का, सो अभी ऑब्जर्वरशिप्स के लिए अप्लाई करें. हो सकता है वो आपको इस जनवरी की इस फरवरी की डेट दे दें और उसके दौरान आप यूएस जाएँ, प्लस सीएस का एग्जाम दें, ऑब्जर्वरशिप्स करें, एंड दैट वुड बी बेनिफिशियल फॉर यू. अगर आप मैच के सीजन से बिल्कुल 1-2 महीने पहले अप्लाई करेंगे ऑब्जर्वरशिप्स के लिए, यू आर नॉट गोना गेट देम. The other thing is कि तो यही पॉइंट. और सेकंड चीज़ ये है कि जो लोग अभी ग्रेजुएट नहीं हुए, इलेक्टिव्स की अपॉर्चुनिटी को मिस ना करें. आई वुड अगेन एम्फोसाइज ऑन दिस थिंग. ऑब्जर्वरशिप्स लेने के लिए मेरे ख्याल से सबसे मुश्किल पाथवे है और इसमें सबसे इंपॉर्टेंट चीज़ जो है वो रिलेशन है, आपके पर्सनल रिलेशंस. अगर आपकी कोई फैमिली रिलेटिव है, अगर आपको कोई जानने वाला डॉक्टर है, मस्ट कॉन्टेक्ट दैम, दे कैन फाइंड यू समथिंग. क्योंकि मोस्टली प्रोग्राम्स के अंदर वो स्पॉन्सरशिप मांगते हैं. लाइक यूनिवर्सिटी ऑफ ओक्लाहोमा में देयर सपोज टू बी समवन हु स्पॉन्सर यू फॉर द ऑब्जर्वरशिप, एंड इट हैपेंस इन मोस्ट ऑफ द प्रोग्राम्स. सो इस तरह के प्रोग्राम्स के अंदर आपको रिलेशन तलाश करना पड़ेगा. 50% प्रोग्राम्स के अंदर कुछ फ़ी है, फ़ी समेत भी 6 मंथ्स 8 मंथ्स का वेटिंग पीरियड होता है. सो अप्लाई एज सुन एज पॉसिबल, मेक योर टाइम लाइन. अगर नेक्स्ट ईयर अप्लाई करना तो अभी से अप्लाई करना शुरू कर दें. और अगर कुछ नहीं मिल रहा तो ये प्राइवेट क्लिनिक्स, पाकिस्तान का पाथवे, छोटे हॉस्पिटल्स यूएस के अंदर ये आपका लास्ट रिजॉर्ट होना चाहिए. पहले बड़ी जगहों के लिए ट्राई करें और जितनी जल्दी अप्लाई कर सकते हैं उतनी जल्दी अप्लाई करें. आई होप सो कि आई आंसर दैट.
Acha, ये एक one more question is about step one. So somebody is asking how many times should we repeat the USMLE step one U word, and whether they should do it online or offline, and if they want to do it online, so how many months should they go for the subscription?
इसके बारे में मैं छोटी सी बात करना चाहूँगा ऑनलाइन और ऑफलाइन के बारे में। दोनों के ना बेनिफिट्स और दोनों के प्रोज एंड कॉन्स हैं, जो मैंने ऑब्जर्व किए हैं। बहुत सारे लोग हैं जो कि ऑफलाइन यू वर्ल्ड करते हैं इन द स्टार्टिंग ऑफ द प्रिपरेशन, और उन लोगों के स्कोर्स अच्छे आते हैं। मैंने पर्सनली अपनी लाइफ के अंदर थ्रू आउट जो यू वर्ल्ड सब ऑनलाइन किया था। तो दोनों के प्रोज एंड कॉन्स हैं, मैं दोनों को सेपरेटली एक्सप्लेन कर देता हूँ। जो सिस्टम आपको बेहतर लगता है उसको ऑप्ट कर सकते हैं, बोथ आर फाइन। एक सिस्टम ये है कि फॉर एग्जांपल व्हेन यू आर स्टार्टिंग फॉर योर स्टेप 1 एग्जाम एंड यू फ्रॉम द डे फर्स्ट यू स्टार्ट विद योर कैप्टन बुक्स। वन पाथवे इज कि आप उसके साथ यूवर्ल्ड को ऐड कर लें। जिस वक्त आप एनेटमी खत्म करते हैं तो उसके बाद यूवर्ल्ड करें एनेटमी का। इट्स गोना कंसोलिडेट योर कॉन्सेप्ट्स। श्योरली शुरू के 3-4 महीने के बाद, 5 महीने के बाद, यू वुड फील वेरी कॉन्फिडेंट एज कम्पेयर टू द पर्सन हु इज ओनली डूइंग कैप्लन्स। क्योंकि श्योरली आप जब एमसीक्यूज पे प्रैक्टिस करेंगे तो आपकी प्रेपरेशन बेहतर हो जाएगी। यूवर्ल्ड के अंदर कॉन्सेप्ट्स भी काफ़ी हैं। लेकिन इसका एक नुकसान है बहुत बड़ा। इसका मेजर नुकसान ये है कि जो लोग शुरू के अंदर अपनी प्रेपरेशन के स्टार्ट के अंदर यूवर्ल्ड को ऐड कर लेते हैं कैप्लन के ऊपर ऑफलाइन, उनको नुकसान ये होता है कि उसके बाद जब वो ऑनलाइन यूवर्ल्ड करते हैं तो ना तो यूवर्ल्ड उनकी असेसमेंट सही तरह उन्हें बता सकता है कि उनकी तैयारी कैसी है। क्योंकि जब ऑनलाइन होता है तो उसके ऊपर आपके ग्राफ बनते हैं कि आपके ब्लॉग्स में क्या परसेंटेज आ रही है, विच इज़ वेरी इंपॉर्टेंट। सेकंड चीज़ इज सेकंड थिंग इज़ कि आप लोग अपनी टाइम मैनेजमेंट के ऊपर काम नहीं कर पाते। क्योंकि पहले आप एक तो ऑफलाइन यूवर्ल्ड कर चुके होते हैं, जब आप दोबारा ऑनलाइन करते हैं मोस्ट ऑफ द क्वेश्चन आपको पहले से याद होते हैं। तो आप जब ब्लॉग्स करते हैं तो आप ब्लॉग जो आपने जिस पे आपने चेक करना था कि आपकी टाइम मैनेजमेंट कैसी थी, वो आप ऐसी 30-40 मिनट्स में कंप्लीट कर लेंगे। एंड यू वुड नेवर नो, आपको एग्जाम में जाके पता लगेगा कि आपको टाइम मैनेजमेंट आती कि नहीं आती। सो आई पर्सनली फील कि गुड वे इज, जैसे जैसे वकास भाई ने बताया, जैसे मैंने किया था कि शुरू के अंदर 5 मंथ्स जो है वो आप कैप्लन्स और जो है जो अपने वीडियो लेक्चर्स हैं और फर्स्ट एड है इसके ऊपर फोकस करें। और आखिरी जो 3 मंथ्स है, मेरे ख्याल से आइडियल थिंग इज टू डू द यू वर्ल्ड ऑनलाइन इन रैंडम टाइम मोड, टू टाइम्स कवर टू कवर। और आई थिंक इट्स अ गुड वे। अगर इससे ज़्यादा दफ़ा भी करें तो उसका थोड़ा सा नुकसान हो जाता है, इन द सेंस कि आप थोड़ा सा ज़रा डिस्ट्रैक्ट हो जाते हैं और बुक्स से दूर हट जाते हैं। तो आई वुड सजेस्ट कि शुरू का 60% टाइम बुक्स को दें, एंड का 40% टाइम चाहे स्टेप 1 हो चाहे स्टेप 2 हो, 2 दफ़ा यू वर्ल्ड को कवर टू कवर करें रैंडम टाइम मोड में, ऑनलाइन मोड में। आई थिंक आपको टाइम मैनेजमेंट बेहतर हो जाएगी और आपको बेहतर असेसमेंट मिल पाएगी कि आप प्रिपरेशन किस जगह पर करें। लेकिन इट्स टोटली अप टू यू, अगर आप शुरू में भी ऐड करना चाहें इट्स नॉट अ बिग डील, जैसे आपको पता है।
So I think Umar Kamal was asking us that whether research. Can you guys hear me?
Yeah,
Okay,
yeah,
yeah,
go
yeah.
ahead. Go ahead.
Okay, so Kamal was asking us that whether it's okay to go for the research electives at Hopkins or whether he should go for to somewhere else, like University of Kansas or UAB. Can you kindly highlight all the the significant advantages and disadvantages of doing electives or observership at these following places like Hopkins, UAB, and University of Kansas Wichita program?
Okay, I think to answer this question, I would say Farhan can answer because he did a observership at Hopkins. But first of all, let me understand the question. So he's asking what are the pros and cons of doing
Research electives versus
observership,
management.
observerships at big places? That's the question.
Yeah, he's actually wanted to ask whether he should go for the research electives at Hopkins or should he go for UAB or University of Kansas Wichita program.
Okay,
He
so
just
yeah, over to Farhan. So what is the exact question? Question about observership at
wants to ask us कि इनमें से किसका फायदा होगा, इन तीनों में से प्रोग्राम्स में जाने में से सबसे ज्यादा फायदा किस प्रोग्राम में है, हॉपकिंस में है, कैंसस में है कि यूएबी में है?
अच्छा, रिसर्च जो है उससे रिलेटेड सबसे इम्पोर्टेंट बात यह है कि टाइमिंग किस तरह से आप कब रिसर्च में एंटर हो रहे हो। अगर मैच अप्लाई करने से पहले आपका कोई पब्लिकेशन नहीं आ रही, सिर्फ वहाँ पे आप एक वॉलंटियर वर्क कर रहे हो, अपना एनर्जीज वेस्ट कर रहे हो, वो यही बात है। मैं जब हॉपकिंस में गया था, मेरे जो मेंटर थे, मैंने उनसे बात डिस्कस की। मैं कहा मैं आपके पास 4 वीक्स का एलओआर ले रहा हूँ, मैं चाहता हूँ कि मैं कोई रिसर्च में भी ऐड करूँ। कहते यार सिर्फ 4 महीने रह गए, ऐसी कोई रिसर्च नहीं है, मैं तुम्हें अभी डालूंगा 4 महीने बाद तुम्हारा उसमें रोल आ जाए। तो बड़ी प्लेसेस का ये है कि वहाँ पे आप ऑब्जर्वरशिप करें, एक्टिव्स करें, एलओआर लें। रिसर्च जो है वो ये है कि डेडिकेटेड एंड एंड अप हैविंग अ पब्लिकेशन, दैट इज बेनिफिशियल। और ये बड़ा डिफरेंशिएट करना पड़ता है कि कौन सा जो मेंटर है वो सिर्फ आपसे वॉलंटियर वर्क करवाना चाह रहा है और कौन सा एक्चुअली पब्लिकेशन भी आपको देगा. सो दैट नीड्स अ वर्कर. तो बिगर प्लेसेस से अगर इलेक्टिव ऑब्जर्वरशिप के एलओआर ले रहे हैं, दैट्स गुड.
Vikas bhai, somebody is asking like, can you tell us a little about the Carthage Hospital and what kind of exposure do the students get in the Carthage Hospital? So can you kindly briefly explain all the stuff?
Okay, so the Carthage Hospital is a small community hospital. It is located in upstate New York, near Watertown, a small city on the Canadian border. It is a small, 198 bed hospital if you include the emergency beds as well. Uh, how I got to introduce to Carthage? So when I came United States in 2012, I was having nothing, like kind of student who has no interactions, no relationships here. So I got to know about that somehow, and it was I was given a chance of rotating 5 months over there. And during those 5 months I did my step 2 CK, step 2 CS, and step 3. And meanwhile I did 5 month rotation in internal medicine, emergency medicine, and family medicine. So then I got 4 different LORs from 4 different mentors, and that really helped in getting residency. When I got resident interview in Montefiore, I was told the same day that they will keep me because of my versatile US clinical experience, because I got 3 different letters in 3 different fields. So then next year we started this program of sending more students over there. In 2013 I recommended like 10-15 students. In 2014 we become more organized, and we made 25 people go there. And this year 2015 we officially started a Carthage externship program with the collaboration of Dr. Amjad Sheikh, who is a director over there. So how we start every like there are 2 parts of this program. One part is for those people who are applying for residency match, and one is for those who have not done steps, they just want to do the elective. So right now from April to September we only consider those people who are going for this year match. Like it is 5 months, April to September. So our best attempt is that we should make at least 5 blocks, and each block should accommodate 6 to 7. So our target is 35 to 40 people. Give them externship, LORs, and make them prepare for this year match. So I posted this information on the MLE forum, and many people sent their CVs to us. More than I explained, more than 150 uh, resumes I myself reviewed, and then we shortlisted based upon the criteria I explained before. So maybe we were offline that time. So let me just briefly tell the criteria. Criteria is all meant a rule of maximum benefit. Those people should be given chance which will be benefited most, and these are the people who have like average to high score with no US clinical experience. So if I get an application from a student who is 270, 75, who also has 2 months US clinical experience, and he's asking for one more month, so he will be lower in my list as compared to a student who has 240, 250 with no US clinical experience applying for this year match. So he will be up the list. Third category is a student who is 215, 210, and he has 9 and 10 months of US clinical experience, and he's applying for one more month. So I would say that if 9 months has not helped you, I don't think a small hospital rotation for 1 month is going to help you. So that's how we basically make our priority list. Then there are few people who are unmatched last year. So we always try to prioritize those people who are unmatched last year. If we think that the fault in their CV is the deficiency of clinical experience, we make them at the top of the list so that we remediate that fault, we fulfill the deficiency, and we will make them prepare again. So this is how all the resumes come to me at my email vakasnawaz777 @yahoo.com. I don't like when people on Facebook send their credentials information, because this is how they can be missed. It's not me that I only want to see the email. I can see the Facebook, but email is a more organized way all the emails they go to specific folder. If you apply on a Facebook inbox, you have a high chance that you can be missed, because I review email, all the resumes 3 times a week or 2 times a week based upon my schedule. So I would prefer that you send me your very brief summary. Not, I'm not asking you about your medical college awards or letters and all those work. I'm asking for step 1 score, step 2 score, step 3 score, CS attempt or not, graduation year, medical college name, and previous United States clinical experience, and what month suit you, like which month you can come physically. So this is information I need with a very professional, just small 1 paragraph, and you can send to me. If you get a reply right away, it means you have been selected. If you do not get a reply right away, there could be 2 meanings. Number one, either you are in the waiting list, and once a slot opens, we will contact you. Or there is a second, maybe you do not qualify those criteria which I just explained. So this is how we already chose 35 people for this year. Now today is May 31st. So tomorrow fourth block is gonna start. That is from June 1 to June 21, 3 week block. And already people who have been selected, they have been contacted and they are going there. If someone in the coming blocks cannot join, then we consider the waiting people. So over there they have a accommodation area, arrangement. The Carthage area, they have a apartment over there which can accommodate 4 to 5 person. They have some small charge for that accommodation, but they do not charge the rotation. And there is a pick and drop service as well, because Carthage is 45 minutes away from Watertown. The bus goes to Watertown, and from Watertown, the Carthage has assigned a person whose his name is Brother Jafar, and I have posted the phone number and the email of that person in my response email. Who people who are selected, we tell them the details. So they contact them. They reach to Watertown. That person comes in car, and they pick up the student and bring them to the Carthage. They spend like from morning 8 o'clock to 1 o'clock. They spend the time in the hospital. In the evening, they go to the emergency medicine, and in the night they come back. So this is how they interact in 3 different departments. They interact in internal medicine, they interact in emergency medicine, and they interact in cardiology. And this gives them a chance to get 3 week LOR, but from 3 different mentors. So they can have 1 week LOR from Dr. Amjad Sheikh, that is internal medicine, 1 week from Brian Veneris, that is emergency medicine, and 1 week from Dr. Mirza, who is cardiology. So after the 3 week, they go back and the next batch comes. So this has been going on for the last 2 years, and this year it is very organized. And I already scheduled up till September 15. After that, I have a list of the people you can still apply. For those people who are not applying this year match, they are next year match, but they want to do some electives, some observership in the winter season, because winter season is not good over there. It's very cold over there, but still we have this slot open. So this is how we are doing that, and we have got very good feedback. Many people who matched this year, they have moved in Carthage. Examples are Usama Arsalan Bey, Noman Akbar, and many more. So yeah, this is a brief summary of Carthage. Over to Noman.
Okay, okay. Let's ask some questions. It's about surgical categorical matching. So let me just start with the questions one by one. The questions are from Zubair Shahid.
I'm sorry, Noman,
So,
just a minute. I'm interrupting you. If anyone who of the person who are online and they want to ask a direct question, first give them the chance. If
okay.
there is no person like that, then you just ask your listed question.
Zubair is online. I think he can ask the questions himself.
Yeah, just make him online.
Yeah,
Over to
he's
Zubair.
online. Zubair, are you there? Can you unmute your mic?
Assalamualaikum.
Walaikum assalam.
Can you hear me?
Yeah, we can.
Thank you very much for organizing this session. It has been quite helpful. Actually, I want to ask very specific questions regarding the categorical surgery matching. I have taken some information also. Like the questions were like, is it mandatory for an IMG to go for prelim before categorical? Number one. Number two, how much should be the duration of for the prelim that an IMG should be doing in order to match for the categorical? And what are the chances of matching it into the categorical after you have done prelims? Secondly, how do you categorize doing a research for 1 year as compared to doing prelims for getting into a surgical program?
Okay, so let me answer your questions one by one. First question I understand is about the categorical surgical residency. So we don't really know much about it because not most of us applied that field. But as we have some, I can after this session is over, you just contact me. I will refer you a person. I think Majid Bhai has been doing in surgery, so we can specifically give you the address of that person. But first of all, surgery is a little bit tough to get in, but it is not impossible. The previous, when we used to do the steps, we were told that it is almost impossible, but that is not, it is how. As you can get in medicine, you can also get in surgery. The only thing you need in surgery first is a surgical background. When I say surgical background, that means that you should do in house job, your experience should be saying that this is a person who did maximum work in surgery, general surgery or surgical subspecialties. Then in when you come to US, you have to have good scores. Good score is not now specific to surgery. They are all specific to everything. Even medicine you cannot have without good score. So just 250 plus is okay. But you have to do a prelim here. Most of the surgical people, they ask for a prelim. And the prelim means that you have to do 1 year of medicine, I guess, and in after that 1 year you apply the surgery. Then you have a better chance as compared to a person who did apply surgery directly. So that is my knowledge about general surgery application, but I'm again telling you we are not the right person to answer this question in a best possible way. After the session is over, I would refer you to Majid Bhai, and he can guide you better.
Thank you very much. I just wanted to ask one more thing. Actually, I talked to a few people who had done prelims, and like I have graduated from Rama Akbar Medical College. So one of my alumni also did a prelim for 2 years, but still he couldn't get into the categorical. So one of the person was quite blunt. He said to me that if you are going for the prelim, this means that your application for categorical was weak. Now again, if you again go for the prelim for a second year, this further weakens your chances of getting into categorical. So I was asking, like, do we have any alternative pathway? Like, if I come to US with good step scores, and I do an externship there for 3 or 4 months, where I have a surgical hands-on experience. So would it help me into matching for the categorical, or do I still need to go for prelims, or do I still need to go for the research, and I need to try my luck there?
Huh? Okay. So I understood that question that you were asking that few friends of you they did a prelim and they were still not matched. So I am not sure about it. That but one thing is very clear: if you go direct categorical and if you do prelim, people doing prelim they are preferred over those who directly apply category. Uh, Doing externship will help that. I will say it's a big yes, of course. If you rotate in medicine, cardiology, pediatrics, it's not going to help you getting a surgical residency. Surgery is something they really look into surgery background. That's what I know. And I have very poor knowledge in surgery applications because I mostly deal with the medicine person and psychiatry, medicine, and neurology people. So I was just told by Farhan that we have some resident in our hospital who just went through the same process as you told me. So after you finish, just get back to me in my inbox Facebook. His name is Fadi Salama. He is our junior in Montefiore, and he actually did the same thing which you are talking about. So I would refer you to him, and I would request him to guide you.
Thank you very much. It has been great help. मैं आपसे ना फिर बात करूँगा इसके बाद.
No
I will
problem.
inbox you.
Okay, over to you, Oman.
Actually, one last question, if I can ask, if it is possible, just one last question.
Okay, go ahead.
Actually, I came to know that if you get a match on J1 visa, you cannot leave US until your internship or until your residency is over. Because if you leave the country, then you have to apply for a new visa. So is this so?
Hello.
Hello,
Yeah, go ahead. Hello.
hello. Can you hear me?
Yeah, we can. Just go ahead.
Yeah, I was asking that someone told me that if you get into a residency program on J1 visa, you cannot leave the US until your residency is over. Because if you leave the US borders and you head back to your own country and you're on J1 visa, then you have to reapply for the visa. However, if you're on H1 visa, you don't have to reapply for the visa. So, is this so? Like, do we need to really apply for the H1 while we are opting for a residency in US?
Okay, so first let me be very clear. This is not all hard and fast for J1. Even many H1 you have to reapply because it's only New York State which gives you 2 year H1. Many states give you 1 year of H1, and after 1 year you have to restamp it. So first of all, this is not only for J1. And now, second thing, this is not hard and fast that you cannot leave US. You can always leave US, but when someone says that, he means that there is a risk. Risk is that when you are coming back, you have to get it stamped. While coming back, you have to get it stamped from Pakistan. If you have got J1 from Pakistan, you have to get it stamped, and that time there is a risk that it can be in the processing and the program will not wait. So, but be very clear, even J1 or H1, some H1 is also for 1 year. So it's not every three program gives you a 3 year. It depends upon your state, which state you are working. There is a very good post on our MLE forum. One post is for H1 visa in the file, that is by me, and one is by J1 visa, that is by Aftab Ahmed. So I would just recommend you read both those two files about J1 H1. You will completely know all the complexities, technical points related to J1 H1. And many people ask us this question, but like few friends of us, they got their H1 from America. They did not take the risk of going Pakistan, applying H1 in Pakistan. So now they are stuck in a sense. They can still go to Pakistan, but when they will come back, they have to get it stamped from Pakistan. That is a
Hmm.
that is a chance. That is like 50-50. Sometimes they get delay processing, not in time, and they will not join back to the program. So, but it doesn't mean that you cannot leave New York, America. You can always leave America, even when you go Canada. People go to Canada, they get it stamp, come back. You still leave America. Canada is not a part of America, so it's not like that. Just difference is that in Canada you get it processed very quickly. In Pakistan there is a chance of delay.
Uh, Thank you very much, Boss bhai. You have been of great help.
No problem.
बता सकते हैं अरसलान को अनम्यूट कर दें और फरवा ने क्वेश्चन पूछना है तो उसको भी अनम्यूट कर दें फरवा
Kis
यू
Farwa wants to ask a question. Okay, let
यस
me understand. Wait a minute.
फरवा एंड अरसलान दोनों को अनम्यूट कर दें
Just
Assalamualaikum.
unmute. Yeah.
Assalamualaikum everyone.
Like,
Because I want to ask that while applying for B1, B2,
can
should
you
I
speak a
bring
little
them
loud?
a
I'm
proof
sorry. I'm
that
sorry. Can you speak a little loud?
hello, Assalamualaikum.
Walaikum assalam.
Can you hear me?
Yeah.
Yes. Because I want to ask that while applying for B1, B2, should I bring them a proof that I'm currently working, I'm having a job, and plus, should I also tell them that about any observership or externship invites because it will show them that I have a plan of staying in US for 4 to 5 months. Is it safe to tell them all my plan or timeline of my stay in United States.
So what I understood the question, first question is that should you show them the proof that you are working in Pakistan some job? Is that true?
Yes, yes.
And the second part is that you should give them the proof that you are not doing any job in America.
No, no, it's that uh, when I go for the interview, should I tell them that beside taking CS exam in United States, I also have some invites for observerships or externships
Ah, okay. So
because
you
it will,
actually
um,
you raised up a very good question, and it is a very misunderstood concept. So let me give you the example. First of all, you should definitely tell the embassy people that you have some job in Pakistan. If you do not have that proof of job, just get a there's some letters from many house job hospitals. They give you a letter. I just forgot the name of that letter, but that says that this person is employed as a house officer in this hospital. We have no objection that he is going to America for specific period of time. So that is a proof of your house job. Second question is very important, that if you tell them about CS, should you really tell them about observership? People think that telling them about observership would strengthen their application. This is a misunderstood concept. It will weaken the application. It happened to me actually. I went there, I told them I have CS. She was a little bit, at those days, she was, I took the impression that she's gonna refuse me. So I use the second stone. I told, oh, I have an observership as well. Then she suddenly started asking question about the observership. She said, is it paid? I said, no, it is not paid. It is just an observership. But she was not convinced. She said that you cannot do observership on a B1, B2 visa because it is something paid. I tried my level best to explain her it is not something paid. Then she told me that I'm not refusing you, but I'm not accepting you either. I'm putting you on suspension until you show me the letter from the hospital saying that your observership over there has been cancelled. You will not get the visa. Then I went back. I asked the Carthage hospital to issue me a letter saying that my observerships have been cancelled. I showed them the letter again, and then I got my visa. This is another thing. I went US and I still went to Carthage and I joined my observership over there. But my point is that just focus. Your main strength in your interview is that you are going for CS. CS is an exam which happens only in America. It cannot happen in Pakistan. You already done with step one. Some people done with step two. The next step is CS, and for CS you have to go to US. Don't just use your observership thing as main. That's I believe, but maybe different people would have had different experience. I think I answered the question.
it's okay. There's one more question. Should I should there be a proper date when we go for the interview, or just a booked 3 months trial is enough for the interview, visa interview?
No, visa interview now system has changed. Now there is no role of SpeedX, there is no role of American Express. You have to have an account on the American Embassy website, and you should pick up your own date. So there is whatever you feel like. There is no 3 month thing. When you feel ready, when I say you are ready, that means that you have a good bank statement, you have a letter saying that you have some job in Pakistan, you have your CS registration letter, you have your MLE exam scores, and I think that's enough. When you have all these things, you can appear in interview at any time when you feel comfortable.
No, I'm asking that should I have the prometric centered letter? If I book the proper date for CS, or just the 3 month period letter?
You should tell them.
Is
You should tell them a proper date, because if you tell them a proper date, they will be more concerned that they have to give you visa before that date.
And one more thing, when I took my CK exam, there were a lot of questions on hospital safety, and they were newer questions. They are not listed in conversation notes, and all the U word and all the stuff, MTBs. They're out of all this. Any? Can you recommend any other source because I cannot find them online or any other newer sources.
You are the second girl who is telling me about this. I heard this thing before as well. Farah, there is new thing about hospital safety questions. I think this after the Obama HIPAA rule, they, they, HIPAA rule के बाद they already they introduced a course. Huh? You guys also did that course where hospital safety maneuvers and all those things. What is the name of the course?
There were some modules offered by the program.
So they are saying that in step exam now they are asking those module related questions related to hospital safety and all.
You can University of Michigan offers some online modules. They can solve those if they want to know more
No,
about.
but question is there whether that module is related to step exam or is something else.
Not definitely sure.
We recently got this information that some exam are asking such questions. So I have noted this in my notebook. We will look into it. That what is the best possible book or best possible link online or a best possible course which can help you to answer those questions. Was it step 1 or step 2?
Step 2.
Okay. Definitely we will get back to you on the forum. We will paste the link. I have noted this.
Thank you so much, Vikas bhai. That was all.
Okay, over to Noman.
Yes, we have a couple of questions from Zahir Qureshi. He's watching us on YouTube. So he's basically asking for any good university with no step one and less than $1,000 per month of clinical experience, either externship or observership. I think that is what he's talking about. Any good university with no step one and less than $1,000 per month. What is the radiology cutoff score, and what are the necessary prerequisites for the radiology residency? And number three question is step three. Uh, Get us each one. Is there any other benefit of step three in the match? Is it a must prerequisite for an interview or for match?
So I would answer the last two parts of the question. One is related to radiology thing and the other is step 3. The first question about the list of the universities which offer observership or elective without step 1 or less than 1,000. I think I would refer to Arsalan or Usama. They must have known the list. For second part is radiology. So we have, you all know Ali Farzan John. He was matched in radiology. So first of all, radiology is not only about scores. Definitely you have to have a very good scores. But score is only a part of it. You have to have a 260 plus. Number 2, you should be green card. Radiology, I rarely have seen people getting radiology without green card. Number 3, you have to have radiology electives. Ali Farzan John had 2 electives in California in 2009 and 8. Then you have to have a research. Ali Farzan John had a 1.5 year research at Harvard University. So I think you have to have all 5, stones unturned. So you should contact him. He will tell you how you can make, if you are so much interested in getting radiology residency, that is a very high residency because you have to do a prelim. Ali just did a prelim of internal medicine with us in our hospital, and now he is going to university, Rutgers University for radiology, 4-5 year residency. But he was having a brilliant CV, like in terms of scores, green card, elective, fresh graduate, research. All 5 corners were very trimmed. So now getting back to the third part of the question, step 3. So this is a very common topic on the USMA forum. I keep on following people commenting on the forum whether step 3 is more important or US clinical experience is more important. What is the other benefit of step 3? So let me be very clear. If you are, it is case to case. If a person has no United States clinical experience, he has done step 1, step 2, he has only 3 months left or 2 months left, and he can only do one thing, either US clinical experience like 2-3 month externship or step 3. Then he asks what she should do. Of course he should do only United States clinical experience. He should not go for step 3 because people, if you go there by that stats, have you seen those stats? 58% people who match, they have 3 to 4 months of US clinical experience. So but if the person has already 1 or 2 months of US clinical experience and now he has 3 months left, So I would say just get one more month of US clinical experience, but also do step 3. Step 3 takes 2 months, 2.5 months. If step 3 is done immediately after the CK, you can do it very well because CK has the same syllabus as step 3. Step 3 gives you the benefit of H1 visa, but step 3 also gives you the benefit of getting matched. Programs do not mention that they are looking at step 3, but they definitely do. Because now competition has so much tough that they have to look at the step 3. And but I would mention one specific thing here. You score very high in step 3, that does not really help you. But if you, God forbids, fail step 3, that really hurts you. Like you have 250, 250 in step 1, step 2, and you did step 3 and you failed. We have one example of this. You are not going to get matched. So just be aware, very aware that step 3 is only about passing. Yeah, getting good score is a good point. Getting 220, 230, people are also getting 240, but at least do not fail. If you think that you can fail it, don't risk, don't take time, because it can help your residency, but it's not a very hard and fast. But if you have time, like you have 3 months, you already have 2 months externship, I would say go ahead, do step 3. There are there is a category of people who did both things together. They did a rotation at the same time they did the step 3, and actually they did well because they use the same rotation time. In the morning they used to rotate, in the evening they used to study. I was one of them. We did during externship step 3. If you can do that, more than welcome, then up to you. But at least if you have zero clinical experience and you are going for step 3, that is a mistake. Okay,
Uh,
over to.
there is a question from Sharia Ranja. The question is about step 1 MBMEs. He says that there are about 17 and 18 of these MBMEs. So how do we know which one to give? Should we give online or should we give the MBMEs offline?
Okay, so yeah, I know that there are 18 NBMEs. In our days, they used to be 12. Now they are 6 more. So I would say take 2 days out from your schedule when you are done with the fourth rotation. Sorry, fourth read. Get 2 days free for NBME. One day should be for the offline NBME, and those NBME should be like offline, which people say don't do online, like very common ones. And the next day should be for the two online. In total, you should do 4 NBME, two offline, two online. But I would recommend while doing NBME, don't discuss with your friends. For example, you are preparing your STEPS exam with a friend who just took the NBME, and after taking the NBME, you are discussing the medical knowledge. So don't discuss that, because he would ask you similar questions and he would tell you the answers, and but he would not tell you that it was in the NBME. Next day when you take NBME, you will score very high and you will be very happy, but that will be your not true score, because you were just told the answers by your colleague. But in the actual exam, when you go, God forbid, you get low score, then you will be at fixed what happened. So to offline NBME, I think all NBMEs have same yield. You can contact the current people who are just doing it. Maybe they can better guide you about the specific NBME. In our days, it used to be NBME 4, NBME 7. NBME 4, NBME 7, they used to say if you score whatever, you cannot score below it. In exam, you will score more than it, but not below it. And actually, it was true for most of the cases. Like I can give you my own example. In step 1, I scored 230 in NBME. So those days we were told that 230 is okay. So we go ahead, we took the exam. In exam, we got 242. So like, and in the second time, when we got the NBME step 2, we got 230, and actually we got 230. So this is how NVMe will help you, that at least you will get something more than that, not less than that.
Okay, so Hassan Mahmood logged in online and he wants to ask some questions.
Okay, go ahead.
Hassan.
So New York, I was about to welcome to New York.
Okay, Hassan, you are mute, I guess. Let me see. Unmute. Hassan, you have to unmute yourself.
Hello, can you
Yeah,
hear me?
yeah, we can.
Assalamu alaikum, Waqas bhai. Finally, a student in King Edward Medical University here in New York for elective at Mount Sinai, and I have my step to CS date in Chicago on 19th of August. I just wanted to ask you and seek your guidance. I have no previous step history. So, what are the challenges and what should I do to say so that I should easily clear my CS exam because I haven't taken step one yet and I'm in final year.
Okay, Hassan, first of all, welcome to New York and be very confident. Be very confident that step one, step two have nothing to do with CS.
Okay,
It's totally a different kind of exam. It does passing C step one and step two does not guarantee CS, and not taking step one, step two does not guarantee either that you will not pass CS. So just be very clear, it is not related. They are totally two different exams. CS you can take anytime. Some people take CS first, step one, step two later, as you are doing. Some people do step one CS and then step two. That is another way. Some do step one, step two, and CS. So there are three different ways, and all three have equal yield. So they statistically there is no data, no figures that suggest that people who directly go for CS they fail more, or people who take after they fail more. So it's totally a different thing because they do not test your medical knowledge. They only test your communication skills, they test your confidence, they test your writing a note, they test your differentials. And differentials are very simple one. Like if you have a shortness of breath case, so you don't need to do step one exam to know that shortness of breath can be caused by pneumonia, pulmonary embolism, CHF exacerbation, COPD, asthma, ABC. You don't need to do step one, step two. These are very basic things. And the book of CS itself is very easy. Like you can just learn those differentials from there. There are good notes shared on the forum. Just take your help from there. Don't keep this information in your mind that you are doing without step one, step two. It does not make any difference. Neither it adds nor it subtracts anything. It is itself an exam. If you pass, that's it. After that, you can take step one. So it's nothing like that. Unmute yourself first.
hello. Yeah, thank you very much for the hello. Yeah, and one more question, please. What would you advise me regarding the 4 weeks elective rotation? What should be the goals I be setting for that to get a good LOR and so that also it also helps me regarding my exam as well.
Yes. So you're right now doing elective?
My elective is gonna start from tomorrow
Okay. Where you are doing elective?
at Mount Sinai.
Okay. So your elective should be targeted at two things. First of all, you have to get a very good LOR that should help you in your match season. But you have to have a second extra benefit of preparing yourself for clinical skills exam, and that is try to communicate with the patients more, learn the basic patient manners, knocking a door. But if, for example, every day, if in 4 weeks, if you see 2 or 3 patients every day, and just apply your basic CS skills to every patient. Knock a door, excuse me, how are you? My name is Hassan, I'm an intern or I'm a doctor on duty today. I'm going to take brief history and physical. How are you doing today? How was your last weekend? If you are seeing a patient on Monday, how was your last weekend? If you are seeing a patient on Friday, what are your plans gonna be for the weekend? In between, you start like that. Enter the room, see the environment, look at the patient. If he is not in distress, he's smiling, sitting, then you can go and you can ask the normal question. But some situations you will come across a patient who is crying already over there, who is already in very pain, his hand is, so don't say how are you. Of course he's not well, you can see that. So don't ask those questions which can aggravate him. So use this rotation, just two patients pick up, or even one patient. You have 4 weeks. 4 weeks means you have like 28 days. One patient a day means 28 patients. Pick up a one patient every day and apply all your CS skills which you are preparing at home to that patient. Complete A to Z. Start a case with him and tell him up till the counseling and closing a case. and then go out. And I think that rotation will help you.
Very much, Vikas. Thank you very much.
Thank you very much. Okay, over to Noman. Nomana, can you hear me? Still there?
प्रकाश जी मेरे ख्याल में सारे क्वेश्चन हो चुके हैं ऑलरेडी खत्म.
Okay, so we have anyone online who want to ask any question, or we should wrap up? Hello? Osama, can you hear me?
Yes, I can hear you. Perfect.
Okay, so I think we should wrap up, and I think this session has two parts: one before the technical problem, one after the technical problem. So you can broadcast and share the link of both parts, and yeah, that's it. I would thank everyone. It was a difficult session today because many people were busy. Aftab, Farooq, Ali Farzan John was busy. I would especially thank Usama, Noman, Arsalan, Farhan Ahmed, and yeah, it's a very tough thing to manage your time on a Sunday, because this is the only one day you get out of your residency. And but if you guys got your questions answered, we think we हमने अपना टाइम हलाल कर लिया. तो आप लोग अपना कोई भी आप लोगों का क्वेश्चन इसके बाद भी आता है, just share the information on the forum. Be very professional on the forum. Okay, I would like to mention one thing here. Everyone knows something happened few days ago on the forum which really spoiled the environment of the forum. Some irresponsible comment from someone on a post. Okay, so I would condemn that, and I would say we are all very mature people. पहले ये होता था कि जितने रिक्वेस्ट मुझे एक दिन में आते थे, I used to get 20, 25, sometimes 40 requests a day. I used to just approve them because we don't differentiate between medical colleges. We don't differentiate even between countries. I have people from India, Bangladesh, Kashmir, China, Russia on the forum. Okay, but if something happens like that, a person who has no medical background, he is a BCom or MBA student and he is on the forum just for fun or gossip, then we really have to look into screening thing, and that would delay your approval because screening needs time, and your pending request will be in pending until we screen it out. So this is one thing. And second thing, I really don't like when people put medical questions on the MLE forum. You should be very clear, this is a medical forum, a forum which guides the people about the career planning specifically related to steps, specifically related. And we are not here for CLAB, we are not here for AMC, we are not here for anything else, we are not here for FCPS. So people are putting medical knowledge question, they put a picture and they ask the people what is the diagnosis. So don't do this over here. You have many different forums, medical knowledge forum. You can test if you want to show off your medical knowledge, you can do there. But over there, here, there should be only posts which are related to MLE exam, STEP exam. So the incident which happened few days ago, after that, we have increased the number of admins. We have told them if a person has a fake account, like a name like MLE, some accounts have name like that. I got an inbox from a person that some people do not want to show their identity, that's why they use MLE name. So this will be unfair to those people who still want to be a part of the forum but they cannot express their identity. I totally agree with that. Some people cannot express their identity but they want to be a part of it, but this is our limitation. We cannot know 6,500 people. This is very tough for us. If you want us to specifically like limit this forum to Chem Collians or King Edward, then people will say that we are differentiating or we are discriminating. I am not that person. We openly open this forum for everyone. All medical colleges are same to us. We don't differentiate whether they are King Edward or Allama Iqbal or Dow. More than welcome, because just you need to tell us that you are from Pakistan, and that is, you will not be asked next question. People, but if you keep on doing such silly, immature thing, this is such an immature thing, We are so mature, we are going to a residency where we will be tested for our communication, where we will be, a resident is a representative of his country over there. So if you do such silly things, I would say you are not ready for residency then. Then why you are on this forum? Just first go there, go back, trim your trim your personality, groom your personality, and then come back. So I'm last time saying that if again something happens like that, we would really have to restrict the approval system, and we would make a team of the persons who will just look into the medical college background, and then they will approve. But I really don't want it now. Still, we are approving, and that one thing is a warning sign. Don't do it again. Whosoever did it, just don't do it again, because that is very disrespectful towards your colleagues. Okay?
वकास भाई
So,
ये मैं सिर्फ 2 मिनट
yeah, go ahead.
अच्छा कुछ लोग जो है ना फेसबुक पे मैसेजेस करते हैं, जूनियर्स सीनियर्स को अप्रोच करते हैं फॉर हेल्प और सब कुछ। तो पहली बात ये है कि मुझे कोई मसला नहीं है, काफ़ी लोगों को कोई मसला नहीं होना चाहिए, लेकिन एटलीस्ट जब आप कम्युनिकेट करते हैं अपने सीनियर्स के साथ या किसी अटेंडिंग के साथ, तो अक्सर ये कंप्लेन आती है कि आप जो है ना ऐसे मैसेज करते हैं जिस तरह आप FB पे अपनी किसी लड़की को मैसेज करते हैं। तो यू हैव टू बी वेरी प्रोफेशनल व्हेनेवर यू अप्रोच समवन। जब भी किसी से बात करें अपने सीनियर से या अपने जूनियर से भी इवन, तो बी वेरी प्रोफेशनल और बी वेरी पोलाइट। तो बाकी ये है कि अपने ईमेल्स में जब आप किसी को ऑब्जर्वरशिप के लिए कहते हैं तो उसको बड़ी पर्सनलाइज्ड और कस्टमाइज्ड ईमेल करें कि यू नो अबाउट दैट पर्सन। कैन यू गाइस हियर मी? हेलो?
Yes, we can hear you. Please go on, Aman bhai.
ओके। तो जब भी आप ईमेल किसी को करते हैं, जब भी किसी आप अटेंडिंग को ईमेल करते हैं, तो आप उसको जब करें तो उसके बारे में आप थोड़ा सा पबमेड के ऊपर उसके रिसर्च आर्टिकल्स होंगे उसके बारे में पढ़ लें, या उसने वैसे कोई आर्टिकल्स देखे होंगे उसके बारे में कर लें। तो कस्टमाइज करके उसको बड़े प्रोफेशनल तरीके से आप उसके पर्सन को अप्रोच करें, और अपनी ईमेल्स के साथ अपने CV, पर्सनल स्टेटमेंट और जो भी स्टेप आपने दिया हुआ है और वीजे की कॉपी, ये सारी चीज़ें अटैच करके उसको ईमेल करें। और सबसे बेस्ट तरीका है ऑब्जर्वरशिप एक्सटेंशिप का कि आप इन पर्सन जाके उस बंदे से मीटिंग वो करवाएं, सेक्रेटरी से कहें 5 मिनट की मीटिंग हो। तो ये तरीका होता है। तो इन दी एंड मैसेज यही है जो वकास भाई ने कहा है, बी वेरी प्रोफेशनल, बी वेरी पोलाइट, सारों की हेल्प करें जितना भी हो सके, अपनी जिससे की जो है ना मदद आप प्रोवाइड करें लोगों को। दैट इज इट। थैंक यू गाइस।
Okay, guys, thank you very much, and we will let's close this session and just compose it. Put the link on the YouTube as well on the MLE forum main link, so that people who miss this session they can see it. Okay.
ओके, थैंक यू
Allah.
गाइस।
All right. Thank you, everyone.
अल्लाह
Bye-bye.
हाफिज़।
Allah Hafiz. Waqas bhai, you need to disconnect.
Okay. Now what we
Thank
should
you.
do?
Disconnect. We are online.
Air and broadcast. Okay.
Yes. Stop. There is a stop button below.